For the latest on the medical aspects of the coronavirus crisis, we're joined now by a former Surgeon General of the United States. Dr. Vivek Murthy served during the last 3 years of the Obama administration. He's the author of a new book with a timely topic, Together, the Healing Power of Human Connection in a Sometimes Lonely World. That came out just last month. Dr. Murthy, welcome.
Thank you so much. It's good to be with you.
We are having some success in reducing the amount of cases and deaths. States are reopening and loosening restrictions, but treatment options are still limited, and we don't know when a vaccine will be here. So what does the next few months look like? Are we on the right path?
Well, I think we have made progress over the last several months, and we've made progress on a few fronts. One is because people have made these extraordinary sacrifices to stay home, to reduce their activity and their contact with others. We have been able to reduce what would have been a much, much worse peak of infections and deaths. But with that said, we have still lost nearly 100,000 people to this virus, and we have well over 1.6 million cases, and that is actually still rising. So we have to take that into account, and we still have to be cautious. The second area where we've made progress is on vaccine development. While we still don't have a vaccine and likely won't have one until 2021, we are seeing more trials coming out with some early stage promising results. But any path to reopening safely runs through testing. And this is the one place where, if we have to be honest with ourselves, we're still struggling as a country because we still don't have enough high quality tests that are available to everyone who needs them. And that is posing a problem for workplaces that want to open up and for states that want to track the infection closely.
Dr. Murthy, it's Dana Jacobson now. You mentioned workplaces that want to open, and one of the workplaces so many want to see open is in the sports world. I know you've consulted with the NBA informally and deal with some other sports organizations. When it comes to team sports, forget fans, just about getting back on the field or to the field of play, how realistic is it that we will see that in the coming months?
Well, I think it is possible for us to see sports restart without fans because we likely won't be able to see crowds gather in significant numbers until we have widespread immunity in the population, which essentially means until we have a vaccine. But with that said, there are plans that many leagues are making to bring back the players so that they can start games and those can at least be televised. But to do that requires a few things. Number one, it requires being able to test with great frequency. And what I hear from many of the leagues and from teams is that they're, one, struggling to figure out how they can get the volume of tests required to test with that frequency. They're also worried about what it looks like if a team is testing its players so frequently when the people in the community around it are still having trouble getting testing. So that is one big challenge. The other big challenge is how do you reduce the risk of players getting infected in the first place? Because we know that there is still coronavirus in our communities. If players are going out into the community, coming back, interacting with the team, and if one person gets infected, then you're at risk of having to shut down the entire team. So some leagues are looking at whether they should quarantine the players for the duration of play. That has implications for their families and for their own mental health. So these are complicated decisions. It's surmountable, and I think we will see sports over the next several months, but it certainly won't be easy. And again, testing is going to be a critical factor in terms of availability.
Obviously, testing seems to be the key to everything out there. I want to turn to your book now. It deals with how vital the human connection is. And right now, in this time where even though places are opening up, we've had so much social distancing. What is your message to people out there who still right now may be feeling very lonely?
Well, first, I just want to say that loneliness was a great challenge that we faced as a country long before the COVID-19 pandemic. And it is normal to experience loneliness throughout our lives. It's a signal that our body sends us that we're lacking something that we need for survival, which is human connection. What I found when I was Surgeon General, though, is that loneliness was far more common than I ever would have imagined. We have over a fifth, over 20% of adults in the United States struggle with loneliness, and many of our children also struggle with loneliness. This affects how we perform in the workplace and at school, but it turns out it also has profound impacts on our health, with loneliness increasing our risk for heart disease, for premature death, for depression and anxiety. But here's the key, is that loneliness is something that we can address. We can strengthen human connection in our life. And the reason I wrote this book is because I wanted everyone out there who was struggling with loneliness to understand that you are not broken and that you are not alone, that many people, including myself, have struggled with loneliness over the years. But I also want us to recognize that social connection is an extraordinary resource that we have, that if we cultivate it, it can be a performance enhancer, it can improve our health, and it can increase our fulfillment. And there's simple ways that we can strengthen connection even in the time of COVID-19 when we're asked to physically distance. We can put 15 minutes aside to spend with the people we love each day. We can make sure the quality of that time really counts by eliminating distraction around us. We can look for ways to serve others, recognizing that small acts of service are powerful ways of addressing loneliness. And counterintuitively, we can also protect moments of solitude.
Dr. Murthy, I'm sorry to cut you off. We are out of time. It is all good advice, and obviously the book is out there for people to find as well. We wish we had a little bit more time for you, but we do appreciate the insight. Thank you.